does social prescribing involve a physical prescription? Charlotte, I think you're probably well placed to answer that.
Social prescribing, for those who are not perhaps aware of what that means, is an arrangement that we have in primary care where we can refer a patient who might have multiple needs that aren't directly health related to colleagues, partners who are more connected with the local community and what that local community might have to offer that patient. Again, that might not be actually anything to do with their health, it might be to do with green space, it might be to do with exercise, it might be to do with social isolation. So no, we don't write a green prescription or send a prescription to a chemist, it's not that sort of prescription, but we do write a referral letter and have slightly different models in all four of our places and slightly different partners leading our social prescribing services, but a lot of those are in collaboration with our local authority and our districts and boroughs. It's a way of making sure that in primary care we pay notice to the wider determinants of health and that we don't just look at fixing someone's blood pressure, because actually whilst I've got lots of medication that can fix somebody's blood pressure, what would be better is if they could get access to a gym or walking routes and lower their weight, which would then have an impact obviously on their blood pressure. So that's social prescribing in a nutshell.
Juliet, do you want to talk a bit about frailty in that context and how we don't focus on physical prescriptions, but we do look at the whole person in the context of frailty?
So from a frailty perspective, a lot of my work and a lot of my clinical interest is in pre-frailty and very much spotting and supporting that and identifying where we can promote health and prevent decline for patients with comorbidities. So indeed, social prescribing and all that a community can offer, and the third sector is really key to that journey to prevent decline, to prevent crisis, and some of the, obviously the negative patient outcomes that gives, and indeed the cascade of cost, etc., etc. So I do think that anticipatory team, comprehensive, multidisciplinary assessment is really important as we move forward and think about how we're going to deliver health over the next 5, 10 years. And from a university perspective, that will certainly be central to our curricula for our medical students, but very much working with all our other healthcare professionals and teams to understand that right from the word go. So very much, reversing from the medical model that I learned from.